Hi, I'm Steve White. Today we're going to talk about another side effect, infection. We've touched on it a little bit before and in different videos, but this is something to really watch because, again, you never want to get behind the curve here. Remember why you get infections here is because the chemo is affecting the bone marrow, which produces the white blood cells. And so when the white blood cell platelet goes down, what happens is that the body is more susceptible to infections. Now, we can go into all kinds of reasons. We can talk about it, what kind of white blood cells, because there's different types of white blood cells. It's all not that important. It is something that's interesting. Might be something you want to talk to your coach advocate about or research and understand. But at the end of the day, when the white blood cells are low, you have more chances of getting infections. So we have to watch for them. One thing we're going to do is we're going to make sure that at least once a day you take your temperature, especially the days right after chemo. And it usually doesn't happen the day after chemo. It's usually the 3-4 days after chemo that some kind of infection can set in as the white blood cells have been beaten up a little bit from the chemo. Okay, but hey, let's just make sure. Take your temperature once a day. Some people so they take it 2 or 3 times a day, but you can see an infection coming on. If your temperature is above 100.5, it's the indicator I use, above 100.5, then that would mean you probably should report it right away to your doctor. Sometimes you'll have low grade and you might wait a little bit and it comes back down, and maybe you're taking some kind of over-the-counter that can help with that. But for the most part, 100.5 is a good border that going above that, you need to call a doctor right away. Of course, with me, I say communicate with doctors any change, okay? Now, with infections, what are the other signs? Of course, you might get the shivers, just like you've got a normal flu or something like that. You might get the little cold sweats, you get the little feelings, you get where you feel real hot. The changes, right? The flushed feelings, those things like that. And then, of course, like we spoke about earlier in other videos, looking for redness around your port, looking for redness around an injection site. Did you hurt yourself somewhere that you could have got an infection? You're more susceptible to these infections. You're also more susceptible just to people walking in and giving you infections. That's why I always tell teammates, you've got to protect your superstar, okay? How do you do that? Well, I have patients, I tell them, post on your door, it says, please wash your hands before coming in. And then they always laugh because they can't come in unless they wash their hands. But they get the point, right? I usually ask the teammates to post the little bottles that use the alcohol to clean the hands. Post those around the house, especially at the restroom, especially at the front door, especially at the back door, especially in the kitchen. Wherever you want to post these things, they're not expensive, but get them around so people can use them and use them. Now, don't be offended, patients and even teammates, when you have people who actually, it's really strange, but actually they almost get offended by the fact that, oh no, I'm clean. Well, this is not the same situation. Teammate, you got to step up to the plate and say, yeah, I understand, but we're really being cautious here. Can you go ahead and use the alcohol? Can you go ahead and maybe shower when you come home to a son or daughter that doesn't really respect it that much? Take the time, be careful, especially when you go to church, when you go out to the mall or somewhere in the crowd. You know what? You need to take that philosophy where you don't shake as many hands or you don't hug maybe as much, and you just be careful, okay? And only when you have infections. I mean, I'm not saying don't hug, I'm not saying don't touch. Touching and hugging are extremely important during this period of time. But watch the infections. And a lot of it is just from the hands. Believe it or not, I can't remember how high of a rate, it's a ridiculous high rate of how many infections actually come from the hands. So clean the hands, clean the face, wash up, straighten up, be careful with that, and look for the signs of infections. We've talked about them. You'll get the feelings, and what are the feelings you're looking for? Change. Okay? It's the flush feeling. It's the feeling like you got the cold, you got a flu, you got those little feelings coming on. Watch your temperature. Be on top of your game. Another area that I want you to be really careful with, we really encourage being with your pet. Pets are amazing how much that they can help you. Just be there. You'll find yourself where you just want to talk, but you really don't want to talk to anybody. You got your pet to take a walk with. You have your pet to sit there and rap with or think with or just be with. pets are amazing how they can sense your feelings. So pets are good. But I'm asking you to do maybe a little strange thing here is that when your pet goes outside to go to the bathroom, have your teammate actually take a baby wipe and clean them. Stay clean. Keep your pet clean, okay? Try, of course, I use the example of dogs because I'm a dog lover. Whatever type of pet you have, keep clean. And you as a patient, you don't take out the cat litter. You don't pick up the dog mess. You don't do any of that. You stay away from that. Teammates, you guys suck it up and make sure you do take care of it. And patients, you don't clean the bathroom, all right? Teammates, you do. And you keep the house as clean as possible and as germ-free as possible, okay? It's prevention. Prevention is extremely important. I hope some of these little tips help you. But the number one tip, always gonna say it, change, any kind. Who we calling? Not the Ghostbusters. You're gonna call the doctor, okay? Find out what they think you should do.